Number 2, stem cell therapy to repair and replenish the brain. Stem cells are the highly specialized cells that comprise all the organs and tissues of the body. Since their discovery in the early 1960s, stem cells have altered the perception of the human body and revolutionized medical research. The use of stem cells for neurodegenerative diseases has become an area of great scientific inquiry. There is no cure for Parkinson's disease, a progressive degenerative neurological movement disorder that affects more than 1 million people in the United States alone. But thanks to the recent stem cell work, scientists are getting closer. Researchers have successfully transplanted fetal tissue-derived dopamine-producing cells into the midbrains of adult patients with late-stage Parkinson's, and these cells have remained healthy and functional for up to 14 years. A preclinical research publication this year demonstrated that the implantation of induced pluripotent stem cell-derived midbrain dopamine neurons caused a similar gradual and sustained improvement in Parkinsonism in primate models of the disease. Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive neurodegenerative disease affecting the spinal cord and brainstem that leads to total paralysis and inevitable death. The goal of stem cell therapy is to slow down and potentially cure ALS. Results from these small phase 2 trials in Israel of an experimental stem cell therapy derived from bone marrow showed improvements in muscle and lung function. In multiple sclerosis, exciting progress is being made through innovative research related to the potential of many types of stem cells, both for slowing disease activity and for repairing damage to the nervous system. Ongoing studies are exploring various types of stem cells, including cells derived from bone marrow, fat, and skin. Scientists are now poised to realize the potential of stem cell therapy to provide much-needed treatment, with many researchers convinced that within years, not decades, stem cell treatments will help provide a beneficial therapy, if not a cure, for a variety of diseases.
So we're fortunate to have Dr. Ole Isacson with us, who's doing very exciting work in this area. Ole, with the important early results in Parkinson's, when do you see a more widespread application or larger scale trials taking off for these sorts of technologies and approaches?
Yeah, I think cell therapy in general is at a prototype stage. It's not like pharmaceuticals or drug development in general. So for cell therapy in Parkinson's disease, as we heard, there's been some success. And the key now is to move the production of these dopamine cells from stem cells. It's actually a non-dividing cell when you get it from stem cells, but it's kind of included in the general term, to a stage where you can actually do this clinically. And that requires a number of new steps. But it's not just Parkinson's disease, as we heard. Many cells are called stem cells, and it's part of the problem of this field. But in the case of ALS, cells that support growth factor production to muscle could delay the disease, as we heard. We heard earlier today about MS, where oligodendrocytes obviously fail, and you could restore the brain. And I think, the thinnest chapter in neurology is always restart to neurology. And I think, that's where we're moving.
And in this field, and with the different types of stem cells that are possible to use, which ones do you see as being utilized earliest on in clinical applications?
Well, I think there'll be two aspects to it. The first is the one that I'm more familiar with, is the neuron itself. Actually, to reconnect, as we heard, the brain is very good at reconnection. You can use a cell like the dopamine neuron, which can accomplish that reconnection. When you get to other things that are more regulatory, you can imagine that the mesenchymal stem cells, that's probably going to be used first. It's easy to obtain. You get it from bone marrow. You can make a batch of these cells and implant them to try to reduce inflammatory aspects. Will then be either used in combination or even as a first exploration.
Thank you.